Hey my awesome people, this is Dr. Shivam, and yes, it is late night 2:30 a.m. but I am here to teach you because I am committed to you. So once your aim is high, your goal is bigger, you tend to do anything which is required to achieve that. So do whatever you can with all you have and wherever you are to achieve your bigger aim, your bigger goal. And my aim, my goal is to get you achieve your dreams and your goals. So today I'm going to talk about a very important topic in obs and gynae, because in recent time they have started asking some calculation in obs gynae. So isn't it very strange, calculation in obs and gynae? But yes, they are asking, and along with that, something very important from this is the estimation of fetal age. So this is very hot and very high yielding topic for you. I will take your 3 minutes, calculated 3 minutes, to just revise you along with the questions asked. So best parameter for estimation of fetal age. So here you have to remember it according to the trimester. So if you see in first trimester, it is crown rump length. In second, it is biparietal diameter, and in third, it is femur length. So how you are going to remember it? You have to remember CPR, and that's it. So C for crown rump length, P for biparietal diameter, and R is for femur length. So you don't need to confuse now. So you won't get confused basically now. CPR is the first trimester, second trimester, and third trimester. So easy, but people get confused in exam because they don't revise it. So the revision is the key, guys. Revise your notes again and again, revise everything again and again which you have studied. If they ask overall, it is always crown rump length, understand? So biparietal diameter, if they ask at what level you see the biparietal diameter, so you have the ultrasonographic scope. So at what level you will see? So you will particularly see at transthalamic view at the level of thalami and cavum septum pellucidum. So this is also again an important question. And they may also ask you, what is cephalic index? So cephalic index is very easy. Basically a biparietal diameter divided by the occipitofrontal diameter. So you will able to answer it now, I understand. So if I ask you, what is more reliable, a biparietal diameter or the head circumference? So if you apply your logic, head shape varies. So it may be flattened in dolichocephalic and it may be rounded in brachycephalic. So your head circumference is more reliable because biparietal diameter is affected by the shape of the head but not the head circumference. So many MCQs getting solved with this simple logic things. So if I ask you, what are the ultrasonographic fetal measurements commonly used? So it is crown rump length, biparietal diameter, head circumference, abdominal circumference, femur length, etc. So these are basically, these parameters are the primary biometric parameter. So if there is primary, there must be something called secondary. So what are the secondary biometric parameters? Like transcerebral diameter, you have to only remember the name. Other like binocular distance, cerebellar distance, clavicle length, radius length, ulna, tibia, foot, and these lengths. So again, if I ask you a single MCQ, suppose it came in your Neetpg 2020, which of the following is the best parameter for dating of pregnancy? So it will be, if it is there in option, measurement of crown rump length in the first trimester. So you already remember your CPR. So in first trimester it was crown rump length. So overall, crown rump length is the best parameter for dating in pregnancy and in first trimester. So how you will calculate it? Now comes the rule of mathematics. So they do ask questions on this formula. So you will be finding it difficult to remember a formula, huh? Why difficult? Being a biology student, so can't you do a addition and subtraction? It is just simple like that. So crown rump length in millimeter plus 6.5 equals to weeks in pregnancy. So I'll solve you a question depending upon that. Now some other question. Most sensitive parameter for assessment of fetal growth is abdominal circumference. So mind the language of question. Here they are asking most sensitive. Now best age for assessment of gestational age is in the second trimester. There is 14 to 20 weeks. Now that question I was telling you, the recent question which was asked is this: at 9 weeks, sorry for that, yeah, so your question was at 9 weeks the approximate age, wait a minute, yeah, they in the question they have mentioned like at 9 weeks approximate crown rump length in millimeter of the fetus would be. Now you remember the formula: crown rump length plus 6.5 is equals to millimeter of fetus. Now here they have given you the millimeter. here what all they have given, they have given the age is equals to the weeks in age. So here they have given you this week, 6.5 is in the formula, and they are asking the approximate CRL. So it is easy. Now what you have to do is just take this 6.5 to opposite side of this. So what it will become? The age minus 6.5, and the answer will be 2.5 millimeter. So it is just basic addition and subtraction. You need not to worry. Being a biology student, you need not to worry, because this is just a simple mathematics. So any 6th or 7th or 8th standard guy can also solve this once he knows the formula. So it's not a worry, but you need to have a picture like these are also asked. Now some other basically three formulas you need to remember. So that was in weeks. Now if they have asked in days, it will be 42, and this is the mean sac diameter if they give the mean sac diameter, because they are asking. So you should anticipate some more future questions. So this was all about this small topic. I don't want to take much of your time because your time is precious. So regarding you, in the end, I have something to tell you, that remain focused at this time. No distraction and no negative procrastination. So be obsessed about your goal and try to study and revise at a very faster pace. So try to be self-motivated. Watch important videos which you have already watched. Revise your notes, solve the MCQ, and have your spirit and head high, because you are striving for something very great. You are going to be a post specialist. You are going to be a specialist, means postgraduate, that is a specialist doctor. So for that you should be proud of yourself. You have come so far. You have been struggling throughout your life and you have survived it. So you are a survivor, and everything that you have been through so will be getting over, and your best days will be coming very soon. So there are still people that you haven't met and things that you haven't experienced. So in the end, I would like to say, be happy and do your best in this coming days, and you will surely achieve whatever you are wanting. This is Dr. Shivam signing off. Thank you.